treat patient, but he was a pathologist. He worked dissecting. His work was on dissecting people. This is called autopsy. And one day, he came up with a brilliant idea that by executing prisoner who received death penalty is wasting of the tissues and organs. So he wrote a letter to the US government saying that I suggest a new way to terminate prisoners on the death penalty, that is by lethal injection. And the bill was created and passed. So in the United States now they abandon electric chair and killing by means of other cruelty will be abandoned, but they use this lethal injection. And that's what we saw in the movie. And then he moved forward from that. He said people should have choices to determine their life. That is to put an end to their lives when they wanted to. So he created a service for lethal injection. As he made it, he didn't inject the lethal drug into the patient himself by hand, but he created a machine with a little pump and a little switch that he put the needle into the vein of the person who need for his help, and the person called him and he come delivered at home. He insert the needle into the vein of the person, and then the patient, what is left to do is to press the button. By that, he didn't kill the patient, but he helped the patient to die with dignity. So that his name is Dr. Kabokian, and he became very famous, and he delivered the service everywhere. And people who felt life is painful, isn't worth living, even those who didn't suffer from cancer or terminal disease, someone with osteoarthritis and felt that the pain is too painful in the knees and didn't want to enjoy life anymore and call for his help, and he then delivered his service there at home. So the patient died, but he was unguilty. The law couldn't do anything to him. Until one day, he made a movie on video and he broadcast it, and he pressed the button himself. So the attorney said, "Aha, I caught you." Then he was arrested and put in jail. And he spent a long time in jail, over 10 years. But along the time, he always fight for the right to die. And he said, everyone should have the right to die, to end his life whenever they wanted to. And a lot of people believe in him. That was, until he came out of prison, he lived for some time, then now he passed away. And this is a book by Derek Humphrey, bestseller, New York Times, United States. It came just alongside with this. Mr. Derek Humphrey wrote, this is the final exit. Actually, it's a manuscript for those who want to kill themselves. He said, dying by jumping from a tall building, hanging, electrocution are not civilized. But what he proposed was a way to die without pain and die with dignity, and the body of the deceased will look good. So he prescribed many medications is a cocktail. Many recipes that a person can use for suicide, including using carbon monoxide in a car garage when someone wants to die, and he said, carbon monoxide can kill people. Just sit in the car and connect the exhaust pipe into the sitting of the driver, and the exhaustion which came from the car, once it enters into the body, it will capture with hemoglobin and soon will pass away without pain. And he said the people who die with carbon monoxide looks beautiful because the skin look pink and it's without pain. So this book was bestseller in the New York Times for a long time, and because of this, an organization was created in the United States. It's called Hemlock Society. The Hemlock Society gives talks here and there in United States, in California in particular, and it has a motto and put on the t-shirts which says, "Let me die like a dog." Because dog in the United States and in civilized country die by being euthanized by veterans, injected lethal dose to them. So any dog that was diagnosed with cancer, with any disease that couldn't be cured, and when the owner bring it to see veterans, the veterinary clinic will put to death that animal. So each year in the United States, about 100 million dogs and cats were pushed to death by the way they call euthanizing or mercy killing, and that is how it's done. So pet shops in the United States has its own small crematorium for these animals, and when you don't want it, you cremate it. And this has to do with pets that when the owner cannot stay there, if someone wants to move to another country for good and no one to care for the dog or the cat, these cats and dogs will be euthanized at the pet shop because they felt that better die than living without any meaning, without anyone to attend it. That is the morality of treating ill animal in the United States. So the Hemlock Society is founded on the principle that everyone has a right to die and die with dignity, like Socrates. Socrates was sentenced to death by the jury of Athens, and when he died, he was offered a bowl of hemlock. Hemlock is a kind of herb, very ancient form of herb, and the bark of the herb is very toxic, and the patient drink and pass away. Socrates drank it and passed away. So among many people that surround Socrates was Plato. So Plato wrote about Socrates and became a story when we study ethics. Socrates believed that morality and ethics is a part of the natural world. It's natural law. It didn't exist outside the natural law. It's a part of the natural law, like gravity and law of physics. But now the Hemlock Society was trying to put forward the will to die that make into law, that everyone who wants to die can die by the service of the doctor. So that was the That was the movement and still exists in the United States, in England, in many countries. And they're fighting to have euthanasia as a part of medical service. And everyone has a right to die. And they call it death with dignity. So the type on the t-shirt, let me die like a dog. So that was the motto of this organization. Palliative care in America and Europe was somehow affected by this movement because palliative care doctor believe that, well, pain and suffering is a part of life. And sometimes you're all going to die, but don't kill the sufferer. Don't eliminate the sufferer. But we have to ask ourselves whether we have treated the person well enough or not. So if we have done enough so the patient realize the beauty and the quality of life, the sanctity of life, then the person would enjoy living longer. So that is the option of palliative care. It's the way we treat. The philosophy is not, we don't prolong life artificially, but we don't terminate life as well. We don't make it shorter, we don't make it longer, we make it as it is. And we try always to avoid pain and suffering and invasive technique. Now I would like to present you another case. This is a real life case. 83 years old man, a Thai, was admitted to hospital because he couldn't breathe very well. And he was very thin. He's about 170 centimeters tall, about my height, but weighed about 40 kilogram. 40, very thin, almost skin and bone. He suffered from a disease which is called COPD, chronic obstructive pulmonary disease. He was a chain smoker. He smoked cigarette about 2 packages a day for 30 years. And he had lung disease. And once he had tuberculosis, he was treated for 6 months. This man has a very interesting past. Once he was a monk, and he lived life of a monk for over 20 years. Just a little less than me. But for 20 years he was a monk. He studied, he passed the exam to the highest grade. And he became chaplain in the army and received the rank of a colonel. And since he was educated, he got the rank of a colonel, and he was invited as special lecturer to many universities, especially monastic universities. He taught there for a long time. And now he became ill. He had 2 daughters. One was a professor in a very famous university, and she teaches subjects of philosophy and religion. This is the eldest daughter. The younger one is a manager of a big industrial company. The 2 daughters don't have much time with her father. His wife is 80 years old and suffer from Alzheimer's disease with diabetes. And she couldn't recognize him very well, and she repeat things repetitively. So when you talk to her, she always ask back, who are you, what is your name, and she always come back to that. After you explain to her, and she asks you again the same question. Now when he was brought to the hospital, which is a medical school, they admit him into a ward with diagnosis of respiratory failure. It means the patient cannot breathe well, and he came up with a very forceful breathing. He breathed with a frequency of over 50 times a minute, and very exhausted, and show sign of swollen feet, and he cannot lie flat on the bed because he felt uncomfortable and he had to sit up to breathe all the time. At home, he was cared by a servant who didn't receive good education. He didn't know about nutrition, he didn't know how to take care of him properly, so he was not well fed. So he was left skin and bone because the attendant didn't know how to feed the patient properly. This is a scenario which happened to tens of thousands of families in Bangkok. Now, when our volunteer visit the patient, the report was that the patient is critically ill and may pass away very soon, maybe in a month or something. So the two daughters became very alert and they come back to look after their father. The professor came. Usually she was the one who didn't spend time with her father, but her younger daughter spent most time with her father. But both of them agree that the father was very sensitive to words and to any bad news. So both conceal the fact that the doctors there told them he may be passing away. So, and the tension start to rise. So between the two, the elder daughter and the younger daughter, one who were very close to the father, the other is not so much close to the father, who will react stronger than the other between the two?
The younger one.
The one who is not close to. That is almost the rule of thumb. The one who is further away will be more aggressive to the patient, especially father or mother, and they will demand more that the patient be treated very well and be treated to the extreme. And since she was teaching religion, she insists that she bring monks of high ranks to come and bless her father by chanting. But the younger daughter said, no, Dad didn't believe in monks. He was monk for 20 years now, he didn't believe in them anymore. Don't bring them. But nevertheless, here the elder daughter brought monks to chant at bedside. At the same time, tears start to pour out from the eyes of the patient, streaming. Both daughters were there. After the monks left, the elder daughters talked to our volunteers. Oh, Dad so appreciate the chanting of the monks so much that he is overwhelmed by tears. But the younger daughter said, Dad was terrified. He was terrified. he didn't want to have monks to chant for him. He didn't believe in them, and he felt that he was receiving bad news. The same situation reported from two sides. One is the elder daughter, the other is the younger daughter. Who should we believe? And who was right and who was wrong? But the patient was breathing very hard, couldn't speak, very tired, and they have to give oxygen in mass to him. Who was right and who was wrong? Yeah, he could write, yes, but they didn't ask him to write. But both daughters tell our volunteers, the elder daughter said, Dad was good, he was overwhelmed with joy. He was tearful when they were chanting. The younger daughter said, Dad was terrified. He was crying. In pain he didn't want monk to be there. Same situation. They saw the same tear, but the interpretation are all different. So that was the first dilemma. The second dilemma came. The doctor came to talk to both daughters. Your dad is in critical condition. I think that he need to have tracheostomy to allow him to breathe, and there we can have a ventilator that he could survive and breathe better. So the younger daughter said, good, you should go on, do what you should be done. The elder daughter said, no. To have a hole in the neck, Dad will lose his dignity. The fight continues between the two sisters. If you are volunteer, how would you decide? Ask the patient. Both of them try not to tell the patient. That is a sad fact. Both of them conceal everything from their father. Didn't tell them anything. That is a sad situation. And being a third person there, you just to listen, you have to comfort the patient. But if you say to the patient, you are in critical condition, whether you would like to have tracheostomy or not, then both daughters will jump at you. How could you do? 1 week passed by, 2 weeks, the patient get worse and worse. He gasps more air. So one day, the doctor had to be there, and both of them were there. And they were discussing about this, whether to have tracheostomy on the patient or not. The patient heard. He heard for the first time. He said, do it. He pointed. Do it now. You're right. But before operation, the doctor have to draw blood sample to make sure that operation will go on fine. Sadly, the platelets in the blood has dropped to a very critical level, below the level that he could operate. And he was too thin and anemic, too pale. So the doctor cannot do it. He said, I give up, I cannot do that, it's too risky for him, 83 years old. And he said, I will pass the patient to palliative care unit. So palliative care doctor come and sit side by side at the bedside of the patient. He was talking something, following the formula, asking the patient about meaning of life, what you think, and the patient just cried. He didn't want to die. And the younger daughter was there. And after the doctor left, her dad was very depressed, had a very sad look, turned away from everything. Feeling dejected, desperate. What should you do? So another doctor, daughter. Yeah. So how can we help? How can we ease off this? The younger daughter called me saying that Dad is desperate. He's now talking nothing. He now didn't want to talk, he didn't want to see. He just closed his eye, looking very depressed. Didn't show any sign to live. He was too afraid to die. Frightened. After being monk for 20 years, after passing all the monastic education, studying Buddhism in depth, being teacher of Buddhism, but the person is inside of him, his emotion is still like a child, very sensitive. He now discouraged to live, very sad. What will you do in this scenario if you are there?
We talk to the two sisters.
One is there, the other is not. So the elder daughter went away because she had many trips and activity. But when she come with big agenda. And she didn't believe, although she is a professor, she didn't believe that her father is about to die. Why? Because she went to see an astrologer. The astrologer confirmed with her that her father is not dying. He lived many years from now. Her relative? No, not there. Only the two.
Now we know why you won't give the name of the university.
So the patient himself was scared and being consulted by palliative care doctor. He felt he's about to die. And he was too afraid, too frightened, shaken. How you solve this scenario? Sing close to the ears of your dad as many songs as possible. Comfort him with your hand. Hold his hand, comfort him, touch him, and sing close by his ears. And she did that. Believe it or not, I received another call early in the morning and said, Doctor, it works very well. Dad became very calm and peaceful. And he was sleeping peacefully more than ever before. And later that afternoon, her dad passed away peacefully. The singing. She said she sang so many songs to him, and she felt this is so beautiful a moment in life that he was singing to her dad close by his ears, and it works like charm. So the music from the mouth from the lips of the loved one, in this case from his daughter, who sang to him, make great change in his mindset, in his comfort, it creates his security, and it fixes everything. It helps him to pass away peacefully. That is one case. And no case are similar, and I never come similar case in my life, even with the same disease. So when you sing song in live singing, it carry a lot of meaning than when you listen to radio or you listen to iPod. But it depends on who is a singer too. If the singer is a person that the patient is closely related to, and it shows affection, that is the healing sound. From this case I learned a lot, and relationship heals, and when we use touching and song sung by the daughter to her dad, that is a very beautiful moment. So the patient felt comforted and enjoyed and became very calm. His face became very bright, and he passed away in a peaceful manner. Yes?
Was the younger daughter with him when he passed away?
What, the younger daughter?
With him when he passed away?
Yes, she was with him.
So it wasn't a withdrawal?
Yeah, always close by, and she sang the song to him, many songs that she sang, and made him very peaceful. Yeah, she chose a song that is Thai song. Music heals, and the song was appealing to the patient. Thai song, slow and fit for his age, and that was the good part of the daughter. And she felt she has done enough for her dad, and he passed away in the most comfortable manner. So, but the elder daughter was not there. She was traveling lecture tour, so too much occupied with work. But the sound of music comfort people, especially when it's sung by the loved one in the family. It helps a lot. So the one who is closer to the patient knows how to treat him more than the one is further away. And we should be very sensitive to the information given by patient or by relatives who have different opinions. But our decision have to, sometimes we have to take side. And we have to decide who is right and who is wrong. So who is right and who is wrong when the monks were there? So the younger daughter was right. And her father was scared of monks and felt that it was a bad thing to have them there with him, chanting Pali. So sometimes visit by religious people could be interpreted as a bad omen. It depends on the experience of the beholder who saw, who have experienced and interpret in one way. Yes?
If in the case that we cannot sing to the patient or we cannot sing to the people, like my mother, we can open the music from the CD or video that the music that she likes, or what kind of music is the best for the patient.
The most
The vocal music and
the music that heals most is the music that the patient likes most.
it's not about classical or whatever, right?
Whatever, the music that the person loves is the music that heals. Yeah, any singer, but for younger people, well, if you put Charin Nantanakorn, yeah, so any person that the singer of that time, yes.
How did you come up with this idea?
It's an intuition. When you have experience and you meditate, sometimes there's a little voice in you will tell you should approach this case this way. So in a second, I advised her to do this, and the result was positive. Sometimes there's no reason, but I ask the question and I ask what would be possible. So this is the solution for her, and it works very well. It happened overnight and he passed away in peace. So it worked. But how did I know that? It's just intuition. Intuitive mind. And it works.
Do you think the music, like classical music or the chanting music, like in Russia, they have a music with the pray?
Yes.
Is it good?
I found Tibetan music very scary. Very scary indeed, and it frightened people. And Tibetan they sound when they sing they sing with low voice. And all the Tibetan chanting are like this. Very scary. So they were singing two notes at the same time. So Tibetan music is not a choice. But for soothing music, you should choose the music that is apparent, appealing to the age of the person. And you have to know this is the test that you grow up with. For a patient who is 20 years old, you shouldn't use Thai music, Sundarapon, Suthe Bongkamhang, Sawali Bakapan, all these, they feel bored. But choose a music that is appealing to the time, age of the patient. And what is this music? Can you tell me what song you like to listen to? And above all, if you could sing, if you yourself can sing, that can help a lot too. During my training in palliative care, I was visiting a hospice in Florida. The doctor there were very compassionate, as well the nurse. And the doctor just embraced the patient, walk her to the door and sing for her. And I was with a nurse there, and he said, Thai doctor could never do this. And this doctor was a surgeon. He was a surgeon, he practiced surgery. Then he stopped his surgery and became palliative care doctor. And he felt more rewarding by being palliative care doctor, working with the dying, with terminally ill. So he practiced singing, he prayed, he meditated, he read books, and he felt this is the calling for him to serve society and other human beings. And that he enjoyed this, even this is the life that he was longing to be. He felt that working in operation theater is no longer valuable life he want to live, but he want to be with the patient, with comforting those who are dying. So that is what I saw in United States. The cause of palliative care has evolved so strongly there, and volunteers in hospice occupied 85% of the jobs in hospice center. Hospice is run by volunteers, not by doctors or nurses or social workers, but by volunteers. Those who are good with caregiving but nursing, they care, they nurse. Those who couldn't cook, who could do anything but cooking, they cook. They offer their time in the kitchen, cooking the best food for the patient to eat. Tell me what you would like to eat. And they brought the ingredient, the vegetable, the meat, bread themselves and cook for the patient. Don't have to pay them. And those who are good with office work, they volunteer to work in the office, doing calculation, paperwork. So 85% of the amount of work were done by volunteers. But it hasn't happened yet in this country. So that is the challenge that I see. We should have similar organization and run by volunteers. And I don't think that hospice and palliative care can work efficiently by for-profit organization. And in fact, private hospital don't like palliative care doctors, because we contradict them all the time. When they want to operate, they want to give ventilation, they want to put in ICU, you say, no, why? It's causing more trouble, more pain to the patient. You're cutting someone with a knife, put tube into their throat, and put them on hook onto the machine, and then cut their vein, put another tube right to their heart, monitoring them, and they live one more week and die in pain. What is the meaning? And they spend 100,000 baht a day in ICU. 100,000 baht a day. Yes.
I think the thing is the hospital become a very big business in Thailand. And if you look at the majority of the hospital, it belong to only few hospital that hold the share in those hospital, and they keep buying.
Yeah.
So I mean the private hospital in Thailand, the biggest one buy many other small private hospital. So and it become more and more business, and they separate each hospital into different level of treating the customers or client with different price.
That's
And
right.
yeah. So I think one factor is about this, about the business.
Yeah, business always look for money, capitalism, and the more you have, the better you are. But it doesn't mean the more you pay, the higher quality of life you receive.
Yeah, I agree.
So palliative care depends on comfort and how to give dignity to the dying and how to allow the patient to pass away in peace. That is what we concern. We don't prolong life artificially, and we didn't cut down the life of a person. We don't lengthen it, we don't shorten it, we keep it like that. Yes, please.
I personally believe in physical contact. Something like holding hands, touching the elbow, giving patting on the back. Like a patting on the back. Sometimes hold or embrace. In our family, we practice this a lot, still do. I believe it convey or transmit or deliver messages. For palliative care givers, is it necessary, and if there's any a barrier or appropriate way to approach patients with a physical contact, please?
Physical contact with the patient. You're not supposed to touch the patient. No. Except the patient allow you to do so or encourage you to do so. And you can touch the patient only after permission. May I do this and that for you? And the question should be open, not pushing. May I do this? May I do this for you? And many times, if the patient is depressed, the answer is always no. Always no. But you have to remain there, listening, ready to jump in and help at any time. And family culture of different homes are different, even in the same country. Because parents, they create their own values for their children, and many times we don't understand the way they communicate in family, and with the polar power in that family, that is another big issue. So you have to be very careful when you enter into a house of a home of the patient. Usually they must identify the main caregiver, and the patient has to consent. This is what the patient wants. And if the patient doesn't want any volunteer, then we're not supposed to get into that house. We will do when they want for it, when they need, and he said yes. Otherwise, it will be infringement into the privacy of the patient. That is the very important principle, respect to privacy. We're supposed to pass even medication to patient, knowingly that he must take this medication. But we have to ask first, do you want me to give you these things or not? Do you want me to give you a massage, a good foot massage or not? If the patient agrees, then we can do. If the patient refused or didn't show any response, we cannot do that. We can propose, but we cannot just do it. And what I said, that path to hell is paved with good intention. This is always true in the care of people, especially in this critical condition. And we have to think ahead of time. Ahead of time. We have to give counseling to best of our ability. We have to communicate to the best of our ability. Right to the main caregiver. In case of this elderly person, he was dying at the age of 83. All the details have been laid down. Even the prognosis. The patient is about to die, probably in 3 weeks' time. This has to be spelled out, and you have to plan to do this ahead of time. And the doctor will ask you whether they should have tracheostomy or not. Prepare the caregiver before then. And you have to decide right now before that time comes. And the best is consult with your father, consult with your patient. But if you refuse, then we cannot do anything. We cannot just walk and say to the patient, you know that you are dying and you should do this and that. We cannot do that. Yes.
I understand that the caregiver can't do that. I don't understand why the doctor can't do that.
Even doctor cannot do that either. If a doctor just walked to the patient and said to him, you're about to die, without consulting the patient with the family, that will be an infringement into the privacy of the family and could result in a very strong reaction from the family. The best we can do is talk to the family and ask them, look, if you're about to die, would you like to be told the truth? Most of them will say yes. And then what about your dad? Would he like to know? It is his life or your life. Usually, paternalism or maternalism play an important role in Thai society, in the family. And they prohibit the doctor. Don't talk this to mom, don't talk this to dad. Don't tell them the truth. Doctor cannot do that. Because when you tell the truth, then the patient died, the patient get angry with you, they sue you. So doctors are very scared of being fired or being sent to court. Litigation is bad and tiring experience. So they can write letter of complaint to the director of hospital. Then you will have a very bad time ahead of you. So all the doctors were trying not to fight against the family. And so we have to comply. We have to understand this is the culture of this country. In the United States, the primary attention is dedicated to the patient. And the doctor will tell the truth right to the face of the patient with full options of the choices. This is the ethic, this is protocol. But in our culture, things never go on according to the standard. Look at our democracy. Yeah.
Sorry, I'm having trouble with this culturally, but what about in the case of AIDS or an infectious disease?
The same. If it's serious disease that is life-threatening, most family in Thailand would conceal the truth from the patient and cause a lot of trouble later on. It's an ordeal in the family once the diagnosis is passed to the patient, and then the family learned it before the patient. most of them will conceal the fact from reaching the patients. But the patient usually know from body language, from the way they communicate, from the eyes, from the concern, from the words that they use. Usually they know, but they don't say it outright. So many times patients live in dilemma. Nobody dare to speak anything. Yes.
We mentioned about living wills. Can you specify in the will that you have to be told?
Yes, you can do that, and you should do it. And I hope that you all will do it before the end of this training. But when you do it well. Think about the people you like to talk to. There is a will about how to plan for your treatment. This is a living will. And this special will that is the will that you abandon. The decision making, you allocate it to another person. And the other is the moral will, where you pass on the message of morality to your loved one, and you ask them to do this after you pass away. You offer thanks, you beg for forgiveness, and you again offer thanks again and say goodbye. That is a statement that we should have in moral view. Many people couldn't do that, but it's a healing process. If you think that you are dying, then you start writing moral view, saying goodbye to your loved one, who should come first, who will first one to get the message, the second, the third, and what message will you give to them? If you write it down, if you can write it down, it will be very good. There is a treatment, however, is going on right now in Australia, America, and England. It's called dignity therapy. Dignity therapy. And they found it very good for preparation of patients who are about to die. A counselor will sit with the patient one-on-one and ask the patient questions. The patient will talk, and the counselor will meet again with all these things transcribed, written in good English, and then read it to the patient. He said, "Is this the information you want to give to be read?" The patient read carefully, will say yes or no, or will edit the paper. Then that work is done, then the counselor will seal in an envelope and open it in the funeral of the patient and read it to the public. This is called dignity therapy. Patient get much better after that. All right. I think I have to stop for today, and don't waste your time watching football too long. And see you tomorrow.